Hi, this is Alyssa Cook, and this is my Week 5 journal regarding the diabetes assessment. After completing the assessment activity in the textbook, I can then assess the following questions, keeping in mind my own results. Explain the results of your assessment and identify your risk of diabetes. The assessment asked a couple questions in regards to my health and if I'm experiencing any of these. If I answered more than 5 with a yes, I should be concerned and consult with my doctor for diabetic testing. The only question I answered yes to was, do you tire quickly or do you always seem fatigued? Just by completing the assessment, it doesn't seem like I may be a diabetic, but it is always good to be on the lookout for signs. I don't think it is too concerning that I'm always tired or fatigued, as I do live a very busy lifestyle. I may just have a lot of stress and it may be taking a toll on me. My risk for diabetes seems pretty low just by taking this assessment, but I always will be conscientious of any changes in regards to my health. Examine the relationship between health and wellness by discussing the impact of diabetes mellitus on at least 3 dimensions of wellness. As defined by our textbook, diabetes mellitus, or also known as diabetes type 2, is defined as a group of diseases that are among the following situations. The body doesn't make insulin, the body doesn't make enough insulin, or the body doesn't use insulin properly. Lack of insulin in bodies can cause harmful effects on our body due to high blood pressures or glucose. The 3 dimensions of wellness that are noticeably affected by diabetes mellitus are physical wellness, emotional wellness, and social wellness. Diabetes can cause harmful physical effects on our bodies, such as risk of heart disease, stroke, high blood pressure, kidney disease, and blindness. Eating a healthy diet, maintaining a healthy weight, and getting some regular physical exercise will prevent some of these risks occurring due to diabetes. Diabetes can also affect our emotional wellness as well due to the stress that it may cause on our mental health. Having to constantly monitor your blood sugar can be very stressful and inconvenient for your lifestyle, and it takes a toll on people emotionally. It can also be confusing as to why a seemingly healthy individual may have diabetes when they are living a healthy lifestyle. This can be tough on our emotional health in many ways as we are trying to cope with it. Diabetes can also affect our social wellness as well, as we do not feel well enough to be around other people, as you may find it embarrassing. Many people have to deal with testing their blood sugars many times a day, which may have to be in front of other people. They might not think this is comfortable to be around them or even themselves. Learning to live with diabetes efficiently is key to ensure you are living the most normal life possible. Diabetes is not curable, but it is surely treatable, so there is hope for living a normal life. Explain 3 lifestyle habits a person can practice to reduce his or her risk of type 2 diabetes. There are many ways a person can reduce the risk of developing type 2 diabetes. Ensuring healthy eating habits, living an active lifestyle, and maintaining a healthy weight are all essentials to reducing your risk of developing this disease. A balanced, healthy diet is making sure you consume the essentials of the food pyramid, such as lean meats, whole grains, low-fat dairy, healthy oils and fats, fruits and vegetables, etc. Your body needs all sorts of vitamins and nutrients from the food you eat, and by feeding it properly, you can maintain healthy blood sugar levels. This will also reduce your risk for developing other health issues that are associated with diabetes, such as heart disease, high cholesterol, stroke, etc., such as mentioned before. Maintaining an active lifestyle will ensure you are physically fit, which will keep you in shape. There are many of the same issues that come with living a sedentary lifestyle, such as those of a poor diet, so regulating an exercise regimen will benefit you greatly. Lastly, maintaining a healthy weight will ensure you are staying at the proper suggested weight. You want to check with your doctor to see what suggestions they may have for your weight. Being overweight can cause harmful effects on your health, similar to those other factors. Eating the recommended amount of calories as well as being physically active will help you maintain your weight. There are many preventive preventative measures a person can take to reduce their risk to diabetes and other related health issues. Thank you for listening to my Week 5 journal and on diabetes assessment.